Reactive erythema and Bullous reaction are immunologic reactions characterized by reddening with or without blistering of the skin or mucosa. The common types are erythema multiforme, Stevens-Johnson syndrome, and toxic epidermal necrolysis. With all these conditions, there could be accompanying extensive denudation of skin with consequent fluid and electrolyte loss, and also a risk of secondary bacterial infection. So all three conditions could be considered as emergencies requiring intensive care. Erythema multiforme presents as itchy, target-like non-scaly lesions of the palms, soles, forearms, and legs. Stevens-Johnson syndrome is characterized by erythema and blister formation, which additionally involves the mucous membranes, the conjunctiva, mouth, and genitals too. The toxic epidermal necrolysis, that's 10, is a generalized scalded type of skin reaction, often due to an allergic reaction to drugs. And a similar reaction occurs in children, which is termed staphylococcal scalded skin syndrome, which is caused by Staphylococcus aureus. So the main causes of reactive erythema and bullous reactions are viral infections like herpes simplex virus, retrovirus, cytomegalovirus, and also mycoplasma pneumonia infection, and adverse drug reactions, for example, to sulfonamides, to penicillins, NSAIDs, as non-steroidal anti-inflammatory drugs, and also to anticonvulsants. And malignancies could be a cause too. And the symptoms are fever, blisters, itchy rash, sore throat, general malaise, discharging painful eyes, and it could be symptomatic. The signs that are usually elicited are fever, flaccid bullae, genital or oral ulcerations, and denuded area of skin. Investigations are FBC, BE creatinine, HIV screening, and blood and wound cultures if indicated. So the main treatment objectives are to maintain adequate hydration, to maintain adequate nutrition, to correct electrolyte imbalance, to maintain normal body temperature, to prevent secondary infection, to identify and eliminate underlying cause, and also to prevent further exposure to the causative agent or drug. Non-pharmacological treatment, withdrawal of identifiable causative agent or drug, the maintenance of adequate input and output of fluid, adequate oral fluids, prevent contact of ulcerated skin with contaminated lining using a nursing cradle. Also early ophthalmological consultation, and nutritious diet too. Pharmacological treatment, for adequate rehydration, you give normal saline IV. And for pain and fever, you give paracetamol oral in adults 500 milligrams to 1 gram, 6 to 8 hourly. In children 6 to 12 years, you give 250 to 500 milligrams, 6 to 8 hourly. And 1 to 5 years, you give 120 to 250 milligrams, 6 to 8 hourly. And 3 months to 1 year, you give 60 to 120 milligrams, 6 to 8 hourly. The control of immune process in patients who can swallow, you give prednisolone oral at onset of condition. In adults 0.5 to 1 milligram per kilogram daily, and taper of over 7 to 10 days. In children 0.5 milligrams per kilogram daily, and taper of over 7 to 10 days. And for the control of the immune process in patients who cannot swallow. Give hydrocortisone IV in adults 100 milligrams 6 hourly until the patient is able to swallow. And then you give prednisolone oral. And in children, 4 milligrams per kilogram 6 hourly until the child is able to swallow. And then you give prednisolone oral, as mentioned. So to treat secondary bacterial skin infection or mycoplasma pneumonia, you give azithromycin oral in adults 500 milligrams daily for 5 days, and in children 10 milligrams per kilogram once daily for 5 days. Less than 6 months is not recommended. You can give erythromycin oral in adults 500 milligrams 6 hourly for 7 days, and in children 6 to 12 years you give 250 milligrams 6 hourly for 7 days, and 1 to 5 years 125 milligrams 6 hourly for 7 days. Less than 1 year you give 62.5 milligrams 6 hourly for 7 days. And for prevention of skin infections, you use chlorhexidine solution 4% topical, or cetrimide 15% topical, or povidone iodine solution 10% topical. Do not use silver sulfadizine, though it's a sulfur drug for skincare. For oral ulcers, you use povidone iodine 1% mouthwash 12 hourly, or chlorhexidine 0.12% mouthwash 12 hourly. Referral criteria: to refer all patients to appropriate specialists.